This is exciting for me to be able to speak to you on this particular topic tonight. And the reason is for the last 4 years, we have been fighting Obamacare tooth and nail. And there's been thousands of us across the United States that have been fighting. Of course, Doctors Tea Party, AAPS, a variety of ways we've been fighting this. And you're all very familiar with the fight that's been had since Obama first took office. We tried to repeal Obamacare, and then we were talking about maybe there's something we could do for replacement and that. So we've been unsuccessful. And so what I have decided to do is give you the facts on what's going on with Obamacare, because it happens to be here right now. So for example, Obamacare is here for better or for worse. What I'm going to do is give you a neutral presentation and then let you decide what the facts are. However, I can tell you that what the left has in promoting the Affordable Care Act, and the Affordable Care Act is all Democrat, leftist promoted legislation. But I'm going to give you the facts, and then you can decide if there's anything better in there. If there's any gold in Obamacare, we'll talk about this, and I'll give it to you in a neutral position. I can tell you what my opinion is after having studied this. The better is only theoretical. There's some things that Obamacare supposedly addresses that are problems in healthcare over the last 20 years, for example, in the United States, and supposedly Obamacare is going to fix these things. Well, these things are going to be touched upon. The problem with Obamacare is if you are going to approach some of the problems in healthcare, you got the wrong legislation. This is 2,700 page legislation, 20,000 pages of regulations. To get to better healthcare, it just doesn't work. So what I'm saying is that the better in Obamacare is only theoretical. But we'll talk about it. We'll see. And this is what the other side keeps on talking about. The worst is actual. Obamacare has a lot of problems, and I'm going to show you what those numbers are for those problems. Of course, we all know the passage of Obamacare was controversial, and it was controversial because it was highly partisan. I think you remember Obama, before he became president, said that, oh, he's going to reach across the aisle, and it would be a bipartisan and all of those great things, and it ended up being highly partisan. The bad news is that Obamacare has survived every challenge. And even AAPS has been in the Supreme Court with amicus briefs fighting Obamacare. But it's there, it's being implemented, and it's coming right at us. And head of my talk here was Obamacare in a blue state. I'm from California. Our state is enthusiastic up in the legislature. We have a completely dominated Democrat legislature. They are enthusiastically going to implement all of Obamacare in all of its glory with the insurance exchange and expanded Medicaid and as many things as they possibly can. So California is going to be the first one in the barrel, and the other states like Texas, for example, or any other red states are going to be able to learn from our a bad mistake and go back and say, well, you know, we don't want to be like what's happening in California. But Obamacare survived every challenge. What we need to do is figure out how it works and how it's going to affect people. We know it's going to be problems. I hope to touch on a little bit of that. And then I'm also going to tell you how Obamacare attempts to fix problems. Once again, the legislation is wrong, that's why it needs to be repealed, and how it attempts to fix the problems is way, way too expensive for what they're trying to do. Okay, so how many people are interested in Obamacare? Well, this was one poll that says, there was a Rasmussen report. Rasmussen's a pretty reliable source. I have seen where Rasmussen is a little bit on the liberal side because they packed their survey with extra Democrats. But even on the Rasmussen report, between 52 and 57% of the people in the United States are opposed to Obamacare. The numbers I see are closer to 60, 65% of the people in the United States are opposed. So how will Obamacare affect you? And this is for everybody in the audience here. You can take a look and you can see the different categories, whether people are insured or uninsured, seniors, taxpayers, and so on. You can find yourself in one of these categories, and in each of these categories there's going to be a significant, tangible, immediate effect by Obamacare. For example, people who are insured. Obama had promised that you'd be able to keep your insurance, you'd be able to keep your doctor. Well, Now that's not going to be the case. So if you're currently insured, you're going to be significantly affected. How about if you're uninsured? Well, if you're uninsured, the framers of the Affordable Care Act never considered that the uninsured, that there's a portion of the uninsured people that decide to be uninsured. And I can remember when I was an intern, there was a period of time where I didn't feel like I needed to have health insurance. I certainly didn't want to spend the money on it. I was trying to buy a house. But there are people who are uninsured now under Obamacare absolutely have to buy insurance, and they have to buy the kind of insurance that the government wants them to have. And that's, of course, we all know is grossly unfair. Senior citizens, profoundly going to be affected. $700 billion pulled out of Medicare to help finance Obamacare. Taxpayers, 20 new taxes for taxpayers to pay for this massive health care legislation. And if somebody is well-to-do, in addition to all these other things, they're going to have more taxes and more things that they have to pay. I've got working families up there, very significantly affected under Obamacare. If you know anything about working families, and a lot of us are clinicians that take care of families, we know that a lot of people just live paycheck to paycheck. Well, now under Obamacare, it's going to be more expensive. It's going to be more difficult to buy things for your children, go to college, automobiles, anything that you normally buy for your children. Well, I'm not going to go through the impact on each of these groups, but just to be aware, there's a significant impact on each of these. Obamacare is rolled out in a timetable, and there's different things that are happening at different implementation dates. March 10th, for example, is when Obamacare was signed into law. And very early on, what they did is they had some of the insurance mandates kicked in at that point in time. I'm not going to go through individual things that had happened everywhere along the line. Just to mention HSAs, which we happen to like, that has now had an effect already where you can't use the money in your HSA to pay for over-the-counter drugs, which is a shame, and a lot of times physicians prefer to use over-the-counter drugs. Here in 2013, one of the things is if you're opposed to Obamacare, you want to say, well, okay, we're opposed to Obamacare, but are they going to do what they say they're going to do? And I live in San Diego, where we're worried about secure borders and immigration. And we say, was the federal government going to do what it says it's going to do with secure borders and immigration? No, you don't see it. Well, under Obamacare, for example, in 2013, there are some physicians who are Medicaid providers, okay? The law has been passed in 2010. If you're a Medicaid provider, you get paid about 17 cents on the dollar. Right now in 2013, under Obamacare, you're supposed to have your rates raised up to Medicare rates, okay? Hasn't happened. Hasn't happened. And then if you ask, if you're a physician and you ask, well, when is this going to kick in? You know what the answer is? I don't know. Okay, so here we are, 2013, Obamacare is in place. We were promised that if we take care of the Medicaid, we were going to be paid more. It's not there. So just to kind of give you an example that so far things have been failing. Back in 2010, they came up with this pre-existing insurance. If somebody had a pre-existing condition, they could get this special government insurance, get covered. And then the idea was that this was going to last until 2014, and then in 2014, the insurance mandate for letting go pre-existing conditions was supposed to drop off, and they wouldn't need the government pre-existing condition insurance anymore. Well, guess what? If you're an insurance broker, you'll know this very well, is that now the money, right now in 2013, the money has run out on the people with pre-existing conditions. And people who did get this insurance, now they're wondering if they're going to make it to the end of the year. And then if you're an insurance broker, I know this one insurance broker that talked to one of the heads of our physician groups in California, said, I have people with pre-existing conditions. The law has been passed. Two laws have been passed. Well, the Obamacare had two different ways of taking care of these. Now that it's out of money, it can't take care of either of them. So right now, Obamacare has actually failed in delivering on some of the things it said it was going to deliver, and the worst hasn't hit yet. And the worst is going to hit in 2014. Very close. This is where the health insurance exchanges kick in. This is where when the Medicaid expansion kicks in. This is when the individual mandate kicks in. So just a few months away, everything's going to really hit. And so once again, so far, they haven't been able to deliver on some of the things that they said they were going to deliver on. 2015, the individual mandate, the penalty goes up. 2016, it goes up even further. 2018, that's where the 40% tax on Cadillac insurance plans kicks in. 40%, that's a huge amount. Okay, well, I'm going to give you the numbers here, and I think that this is really interesting. I don't know that people carry this around in their head, but it's interesting to see that 15% of the population have Medicare, and that a very high portion, 48%, have employer insurance, and that's very, very fragile under this legislation. Private insurance, 9%. The uninsured, let's see. Yeah, this includes illegal aliens and Medicaid that are going to, they haven't signed up yet. 16% of the population, approximately 50 million, once again, if you count the illegal immigrants. And then Medicaid's about 13%. The total number on this, 84% have insurance coverage, or what the Democrats would call access to care, and it's only 16% that don't have insurance. So those numbers are very telling. If you recall the debate that pushed Obamacare forward was that the left wanted everyone in the United States to have, quote, access to health care. And, but if you take a look, well, how many people are you talking about? You're only talking about 16%. And with this massive legislation and everything else that's going on, and I'm going to expand upon that here in just a second. So buying health insurance today, well, guess what? 84% of Americans have insurance coverage one way or another today. Arguably, those who need health care the most would be the uninsured. And once again, a bureaucrat thinks that if you're uninsured, you need help. And whether if you're uninsured and you say, look, I'm doing fine, and if I need insurance, I'd go get it, or have a relative that's a physician and he takes care of all my trouble, those aren't taking into account. But the left thinks that the 16% need help. Once again, the impact on the various groups with regards to the type of insurance you're going to have is going to be big changes in the Medicare, individuals with employer-based insurance, private insurance, and the Medicaid. Winners and losers under Obamacare. Once again, this is kind of a neutral type of statement. You'll see this on television, but actually the winners it's just an illusion, and the losers are going to be actual. So let's use the arguments that the left comes up with all the time. Who's going to benefit from Obamacare? Well, they seem to think when they crafted the legislation, once again, the uninsured was going to benefit. We had a study come out, and we heard about it from our first speaker, the congressman, about just a little less than 2 weeks ago, the Oregon study came out. Is everybody familiar? Raise your hand if you heard about the Oregon study related to Medicaid. Okay, this was something that we have known all along. What the Oregon study showed is after a 2-year period of time, it didn't matter if you had Medicaid or if you were uninsured, your outcome was the same. So in other words, if you take a massive amount of money and you try to drive some of the uninsured into Medicaid, well, that's great, but they're not going to have a better health outcome, so why do it? So we now have that as a study that's out there. We knew this all along, and the way that we articulated this is we said, look, just because you have an insurance card, that's not the same thing as having good health care or health care outcome. And the thing is, so this has been proven, and once again, the massive amount of money being spent on the uninsured, now you can go back and say, look at this really isn't worth it. The people that are going to have the biggest problems, Medicare is used as a funding source for the Obamacare. And then the employer-based plans, they're going to have some jeopardy. The plans are going to be more expensive. There's going to be a push to expand the benefits beyond what the employer thinks the employees may need, and so on. So there's a lot of stress in the system from that standpoint. Okay, if there is only one thing that you take home from my talk tonight, this is what I want you to take home. And it's a pie chart. And doctors always like to sit around and talk about dividing up the pie. I can remember back when I was an intern, we used to love to talk about dividing up the pie. But anyways, what this slide shows, a couple things. Number one, the data for this comes from the Congressional Budget Office 2010, 2011, so the numbers are a little bit old. This text was written in 2012. Here we are in 2013. So the numbers are a little shy. So I'll update you on the numbers. But what this slide shows is what the total cost of Obamacare is between 2010 and 2019. And it's really closer to $1.3 trillion. Okay, that's from the taxpayers. Not included in that figure is the $700 billion that's getting pulled out of Medicare. So the total cost of Obamacare is over $2 trillion. Now, I read the CBO's report right before the Senate version of the bill got passed. Actually, it was like a 25-page report. And Harry Reid was real interested in trying to get that number under $1 trillion. And so before the Senate bill passed, it wasn't even 1.8 trillion. It was like 860 billion. I took a look at the report, and what the CBO does, when they come up with a figure like that, that's not the total figure. That figure is the amount that they can find. And what they'll say in their report is, we found 1.8 trillion, or now it's 1.3 trillion, are the costs that we have determined, plus some extra amounts that we haven't been able to tabulate yet. So when you're talking about the cost of Obamacare, 1.3 trillion, 700 billion out of Medicare, plus all of the costs they don't know about yet. So it's way over $2 trillion. Okay, so that's the cost. That's a good number to keep in mind. But what this pie chart shows is the relationship of where the money is going to be spent. And there's two numbers that happen to be used in two different categories. And these numbers are good numbers to remember. And that's, once again, 84% of the population has insurance coverage, 16% doesn't have, okay? That's one use of 16 and 84. There's another use of those two numbers, and it's funny that there's this symmetry. And that's that when the money gets ready to be spent on Americans in Obamacare, the 84% of the funds, that big dark part, 84% of the funds, that's all getting spent on the 16% of the people that are, quote, uninsured, and only 16% of the $2 trillion is being spent on the people who currently have insurance. Well, from AAPS's standpoint is, first of all, you don't need to spend any money on the people that already have it. Why would they spend money on the people who already have insurance? Well, they want to expand the benefits, they want to do this, they want to do that. They want a government mandated type of benefits, and recycling the insurance that the 84% of the people in the United States have does cost 16% of Obamacare. But once again, as far as the 84% of the Obamacare being spent on the 16% that doesn't have insurance, well, once again, half of those that get put into Medicaid, there's not going to be any improved outcome. So we can see that this is a financial train wreck. I'm not sure if Backus was referring to these numbers, but this is definitely a train wreck. This is definitely bad calculating how to spend money on health care. So I'll go on to the next here. All right, so let me talk about how we're going to impact, how the impact on the uninsured is going to break out. Currently, without Obamacare, there's 41 million, approximately 41 million uninsured. This does not include illegal aliens, because illegal aliens are not covered theoretically under Obamacare. So the 41 million. After Obamacare, there's still going to be 10 million uninsured. So once again, Obamacare was passed so we could take care of the uninsured. Well, only 75% are going to get insurance. So you take a look, okay, so with that 31 million, how are they going to get their insurance? Well, half of them will get it through expanded Medicaid, and then the other half will get it through the insurance exchange. The problem with the expanded Medicaid, and they know this, as bad as Medicaid is right now, and it's bad, it's real bad, it's going to be worse when you have all of these additional recipients in there, because there's not more doctors getting into the system, and certainly not going to be more doctors that are going to be taking those rates of payment. And as I mentioned, they haven't increased it like they said they were, but I don't think that that would be an inducement. So the Medicaid is going to be, the care is going to be diluted. And then those that they think are going to go into the health insurance exchange, these people are low income, and they will have a difficult time affording it. Maybe I can end with this slide, and this is another good slide that you should walk away with. And that's this government assistance. You heard about low-income people, the government's going to buy their insurance for them, and that, well, that's a fallacy. And the reason is, once again, I dug into the numbers, and here's what I figured out, is that for a family of 4 who make $88,000 or less, which is is at 400% poverty level, down to 133%, these are going to be people who are low income, that can buy their insurance through the exchange. They don't actually get a rebate. They don't get a check in the mail. They don't get a subsidy. What they do is they get a discount off more expensive, a higher, more expensive type of insurance under Obamacare. Let me say that again. Here's what the government's done. Right now, our insurance costs about this for 84% of the people in the United States. Under Obamacare, what's going to happen is the costs are going to go way up. And what they've said is okay, well, the low-income people, we're going to give them a subsidy. But what it is they just get to purchase Obamacare insurance at a cheaper level. So they get to pay for it down here. But it's still going to be a net more expensive insurance. So for the people that are supposed to get the subsidy, the people that are under 88%, they got scammed on Obamacare. Here's the scam. It's real simple. They've taken insurance, they artificially inflated the market and the price, and then they said, but oh, for you people that are low down, what we're going to do is we're going to discount this down, and we're going to give you health insurance. Well, they haven't given them anything. What they've done is they've just more or less had a Ponzi scheme and reworked the numbers, and nobody's going to get money, and there isn't any real tangible subsidy. All they get is a break on artificially inflated cost of insurance. Well, in any case, I think I'll stop there because I don't want to go over my time. I don't know what I'm going to do about questions. Can I take a couple questions right now?
At the end of the time, we'll have at the end of the day.
Okay, so I'll take some questions later on this afternoon, and thank you for listening to my presentation.